So I hope everyone's doing well and that you found that these questions and watching me work through them have been helpful for you. I know that NCLEX style questions, they're not easy. That's just the facts. They're not easy. And getting used to them and getting good at them really comes with practice, and it comes with time, meaning that you're spending a lot of time just practicing questions. So make sure that you set time aside during the day or during the evening, whatever works in your own personal schedule, to focus on just practicing these questions, getting good at them. Besides just being strong in content and nursing content, you have to also be strong in critical thinking. And NCLEX style questions, they're not black and white. They are very analytical. So they're going to require you to critically think, to apply what you know as a nursing student to these scenarios, and to answer these questions as if you are the nurse with all this nursing knowledge that you have. And remember that the NCLEX world, we always say this, right? The NCLEX world is not the real world. The NCLEX world is this perfect ivory tower environment. And so if you think about that, it's really helpful. So what does that mean to you? It means that if everything works like it's supposed to work, whether it's working in the bad way or it's working in the good way, what should happen? Just based on perfect scenarios, textbook scenarios as we know them, what should happen? This can kind of help you work through different questions and work through different problems that you'll run into in trying to answer the questions. Sometimes when we apply what we do in practice, it really starts to confuse us. So with that said, I wanted to focus on some priority questions, priority style questions. Now, the big thing with priority questions is this. Know that if you're dealing with a question that's a priority, more than one of the options are going to be right. In some cases, all of the options, A, B, C, and D, can be right. Your job in answering the question is to find the best answer, the most urgent need, the most important thing. What do you have to do first, now, and immediately? That's how you answer a priority question. So we're going to practice these few that we have up here. So let's start with the first one. An older male client comes to the geriatric screening clinic complaining of pain in his left calf. The nurse notices a reddened area on the calf of his right leg that is warm to touch, and the nurse suspects that the client may have a thrombophlebitis. Which addition assessment is most important for the nurse to perform? So I always read the question first, and then I go back a second time and underline, circle, box, whatever. I just want to highlight the most important parts of the question so I know what I'm focusing on. You're going to have questions that are big and lengthy sometimes, and you're going to have information in there that you don't necessarily need to answer the question. So it's important for me to really drill down to what is the question asking me. So I'm going to go back and I see an older adult male client comes to the geriatric screening clinic complaining of pain in his left calf. So I'm going to underline this. Pain, left calf. That's important to me. The nurse notices a reddened area on the calf of his right leg that is warm to touch, and the nurse suspects that the client may have a thrombophlebitis. So immediately I'm thinking that this person has what? This sounds like a DVT to me. DVT. Which additional assessment is most important for the nurse to perform? So with this information that I have in this scenario, I'm talking about a client that I suspect has a DVT. Which additional assessment is most important for the nurse to perform? Most important tells me this is a priority question. So already I'm thinking that more than one of these is a right answer, but I'm looking for what's most important. The urgent, the now, right? So measure calf circumference, auscultate the client's breath sounds, observe for ecchymosis and petechiae, or obtain the client's blood pressure. So thinking of a DVT, right? And for all NCLEX style questions, think about expected outcomes. What do you expect to happen based off of the scenario? What do you expect to happen based off of the disease process or the abnormality? So measuring the calf circumference, I could do that, and I should, because it's going to help me to determine if I have a clot in there. So I'm going to leave that alone. Auscultate the client's breath sounds. I'm going to leave that there too, because DVT, I know, can travel to the lungs, and that will cause a pulmonary embolism, and that's pretty important. So if I suspect that this person has a DVT and I see that they're complaining about pain in the left calf, and I've already looked at the right calf and it's warm to touch, I'm thinking DVT could travel, airway, that's a priority. Observe for ecchymosis and petechiae. Well, I'm going to get rid of this and I'll tell you why. Because ecchymosis and petechiae, these are not symptoms and these are not signs of a DVT. Petechiae I might see in somebody that had a fat embolus, but bruising in petechiae, that's not a sign of a DVT. So I'm going to get rid of that. And obtain the client's blood pressure. Well, I could do that, but that's not really going to help me take action against this DVT that I suspect. So I'm going to get rid of that. That's not really important. So I'm left with these two things. Measure calf circumference because that's directly related to this DVT, or auscultate the breath sounds because that's directly related to the DVT and the expected outcome that it could travel. But the question wants to know what's the most important. So even more important than measuring the calf circumference is auscultating the breath sounds. Because if this person has a pulmonary embolism, they would go down the drain fairly quickly. Measuring the calf circumference is only going to support the data that I suspect. It's going to support the fact that I think it's a DVT, but that's not more important than listening to the lung sounds, listening to breath sounds here to make sure that there's not a PE going on. So let's look at the second one. The nurse observes ventricular fibrillation on telemetry and upon entering the client's bathroom, finds the client unconscious on the floor. What intervention should the nurse implement first? Implement first. Again, I see that first and I know this is a priority. What am I doing right now? What's my urgent need? Now reading it again, I see that I saw V-fib. I walk in the client's bathroom and they are unconscious on the floor. What am I going to do first? Keyword. Administer an antidysrhythmic medication. Well, I would certainly do that for V-fib. Start cardiopulmonary resuscitation. I would certainly start CPR for V-fib. Defibrillate the client at 200 joules. Well, I would certainly do that for V-fib as well. And assess the client's pulse oximetry. Well, the question didn't say anything about the client having a pulse oximeter on, and this is actually not a priority at all because this is really assessing technology. And when I say that, I mean you're assessing the machine. You're not assessing the patient. And we always want to assess the patient first, so I'm going to get rid of D right away. But I know that A, B, and C, these are all right. These are all things I would do for V-fib. But the question wants to know the intervention I'm going to do first. Remember, I saw a V-fib. The client's unconscious on the floor. What do you do right away? Start CPR. That's the very first thing you should do. You're not going to immediately defibrillate, and you're not going to immediately give the medication. These are things that you might initiate after, but the first thing you're doing is starting CPR. Now let's look at this one. The nurse assesses a post-operative client. Oxygen is being administered at 2 liters per minute and a saline lock is in place. Assessment shows cool, pale, moist skin. The client is very restless and has scant urine in the urinary drainage bag. What intervention should the nurse implement first? Implement first. Whoops, wrote over my word. I'm going to box this off again because it's important for me to focus on priority. What should I do first? So going back like I always do, I'm assessing a post-op client. Oxygen's being administered. I have a saline lock in place. In my assessment, I have cool, pale, moist skin. The client's restless, scant urine. This assessment data sounds like what? Sounds like shock to me, hypovolemic shock. So I'm already thinking this, hypovolemic shock. So what intervention should the nurse implement first? Remember, we have to think about expected outcomes. So what do you expect to happen in shock? What is it happening in shock? What should we do for it? Because this is the information that we have and we want to know how to act right away. So measure urine specific gravity, obtain IV fluids for infusion protocol, prepare for the insertion of a central venous catheter, or auscultate the client's breath sounds. So I'm looking for the priority intervention here, and I'm going to move this up a little bit. So, measure urine-specific gravity. Is this the first thing I'm going to do? No. I'm thinking this patient's in shock. I'm not going to waste time measuring the specific gravity. I already know that there's scant urine. Obtain IV fluids for infusion protocol. Well, I'm going to leave that because I do want to give fluids. This patient is going into shock. I need to resuscitate them with fluids. Prepare for insertion of a central venous catheter. Well, I could definitely do that if I'm going to be administering bolus doses of fluid, or if I need a more permanent line to administer different medications or therapies, a CVC would be helpful. Auscultate the client's breath sounds. Well, I could do that. That might be something that's important to help in treating or assessing shock, but I'm not going to do that first. That's not the first thing I'm going to do because I'm worried about getting this patient resuscitated with fluid. So I'm going to get rid of that. So I'm left with B and C. Obtain IV fluids for infusion or prepare to put in a central venous line. Now, the first thing I want to do is resuscitate this patient. I know this is shock that's happening. Very first thing I have to do is resuscitate. So I'm going to get those fluids before I put in a central line. Why? I already know that they have an IV in place, so it's not as if I don't have any access. I do. And before moving on with any more invasive therapies, the very first thing is to treat the issue, which is shock, by getting fluids on board. And let's look at this one finally. A client diagnosed with angina pectoris complains of chest pain while ambulating in the hallway. What action should the nurse implement first? So looking for the action that I need to implement first. The first thing I have to do, again, priority. So I'm talking about someone that's got angina pectoris. They're having chest pain, and we're ambulating in the hallway. The first thing I need to do, got it. Support the client to a sitting position. Ask the client to walk slowly back to the room. Administer nitroglycerin sublingual tablet, or provide oxygen via nasal cannula. I'm going to move this up again. So the first thing I want to do, let's start from the bottom. Provide oxygen via nasal cannula. Well, I'll definitely want to give oxygen to this person if they're complaining about chest pain related to angina. Give them nitro. Well, I certainly want to do that as well. That can help vasodilate, get that blood moving. Ask the client to walk slowly back to the room. Well, this could be a possibility, but if they're experiencing chest pain right now, then I'm not going to have them move anymore. So I think I'm going to get rid of this right away. Or support the client to a sitting position. So I'm left with 3 options that I know I'm certainly going to do for this patient experiencing angina, but this is a priority and wants to know what to do first. The very first thing I should do before putting on a nasal cannula, before giving nitroglycerin, is to support the client to a sitting position. Have them sit down. We know that this angina often comes on during periods of activity where there's an increase of oxygen demands. And so with that, if I stop, meaning help the patient to sit down so they're not ambulating anymore, one, that's a safety measure. And 2, it's going to help to decrease the pain before I initiate any other therapy. So the very first thing I should do is support the client to a sitting position. So when you look at these priority questions, treat them as if it's a list of tasks that you're going to do, but it's asking you which one you should do first. And that's a good way to try to drill down to really what is the order of activities I'm going to do and what's the most important. So I hope you found this helpful. And continue to practice your questions, apply these skills, use your critical thinking, and I promise that these questions for you in a testing scenario in school or on your NCLEX, they will get better. Good luck to you.